It's a pleasure to be here. My name is Scott Hays from the University of Illinois, and I want to talk to you about the actual adoption of these kinds of laws in local communities, particularly those laws that affect local public health governance. So we've created a model of local integrated governance and calling this a new role for local public health. I and Janine Toth have been working on this particular project for a while. Hold on a minute. Here comes a local council member now. What do you know? Excuse me, Madam Councilwoman. I'd like to talk to you for a moment about your local public health department.
Public health?
Yeah.
Oh, there's that office on the other side of town. Do they deal with raw sewage?
Well, yes, they do deal with raw sewage, but they do that and they do so much more. They do restaurant inspections, they educate the community to lead healthier lives, they provide immunizations, and they get grant funding to help the efforts that they do.
Oh, that's fine. That is just fine. I am sure they're doing just such a fine job, especially in getting those grants. But so long as they don't come to us for more money. I mean, you know, our county is just so tapped out that I hope they keep up the good work.
Okay, well, that sounds good.
But I have to go to a meeting right now. We're developing a parking garage so more people can drive into town and so excuse me if you will.
Well, I mean, wouldn't you like to stay or stick around?
Well, actually, no, I've got to go, but tell all those people, you know, election's in April, tell all those people they're doing a fine job.
Well,
Thanks a lot.
I'm sorry, I'm just a researcher. I don't even live here.
Oh.
Okay. Well, anyway, that was effective, as you saw. And that is part of the problem that I think we have with public health law, particularly in local communities, that local public health does remain invisible to the community. It looks like, number one, the services, if the public health is doing a good job preventing disease, then they're more invisible. Programs that are reducing staff lead to further invisibility. This other idea is that doesn't cost a county a whole lot of money, but nobody still makes the case for the economic value of local public health. And then public health ends up precariously positioned at budget time. So the local public health department is thwarted from gaining sufficient local buy-in to promote health at the community level. So we propose establishing laws that create the infrastructure to ensure the adoption of local public health laws. We saw a little bit about this in New York City when we talked to the health commissioner that says their structure, the way their board of health has this authority and it's appointed by the mayor, creates the opportunity to adopt powerful public health laws, and that's exactly what we're talking about here. Local integrated governance creates local buy-in and support for public health. It increases opportunities for public health law adoption. So these are the 5 principles I have here, and they're out here on this poster. Establish a local community health board, meaning that the purview of community health is the community and not just the health department. This health board uses the 3 core functions to assess health at the community level, to assure that services are provided by someone in the community, not just a health department, and develops a policy role that can adopt the policies in all of the agencies, use health in all policies as a guide to create the opportunity to create the public health laws and give them life. We also say that this health board has authority over the health department. It's purposefully designed to represent the political sector, the health sector, and the community sector. And the community health board ought to be, and this is unlike the way it was done in New York, appointed by multiple authorities. The strength of evidence here is not large yet, but I'm doing the best that I can. We have some quotes here regarding the comments that we've received, and we've talked to local health departments throughout the country. And so we say the effect here is potentially large. The strength of evidence remains a little bit weak. There are certain researchers out there who would like to have more funding to continue studying this work. And I'm not going to lie to you, friends and neighbors. It's going to be tough. It is tough to change the existing rules of the game, the rules and the structures that underlie it. But again, New York, as we've seen, is a really good example of how we could take this opportunity to change the rules of the game to help the wonderful work that all of us do, and some of the ideas that are presented here to be adopted, given life, and turned into law if we just simply do make my recommendation for critical opportunities by adopting local by integrated governance nationwide in local communities. I thank you very much for your time. Have a good day, and vote for me.